As the head of the authority, I have been directed that this report should not just be lost, that the recommendations in this report need to be followed up. And there is a reason why we have requested the Minister of Health to raise this occasion. This is a serious issue in this country, and it impacts on what we call the population dividend. Ladies and gentlemen, Uganda's population now at about 45.9 million people, growing at about 2.9% per annum. And half of this population is under the age of 18. Over 57% are working population. The youth structure presents a dividend, an opportunity, but it also presents a pressure if not well handled. For it, when we look at the census, half of the youth are not employed. They are not in education, but they're also not employed. 33.1% of households still remain in subsistence, and 12% of the person aged 10 and above experience probable psychological distress. These are not isolated statistics, they form a pattern. One of the issues that we see as the determinants that the rapid growing youth population by unemployment, subsistence life, urban pressure, substance misuse, and social vulnerability is generating psychological strain at a population scale. Mental health is therefore not emerging randomly, it is emerging demographically. It follows the pattern of the population. The SUPRI 2025 findings show that one, increased by 20% between 2021 and 2024. 7% facility report. Approximately 24% of the adults and 23% of the children are affected by mental health conditions. Fewer than 1 in 10 Ugandans who need care receive the appropriate treatment. This is not only a health system gap, it is a human capital risk. The monetary value of loss of productivity due to mental illness is substantial and rising. Without accelerating reform, graphic dividends narrows. If we address it strategically, the dividends expand. The evidence that we have produced in this report compels us to move from viewing mental health as a specialized clinic concern to a cross-cut sector population planning priority. Accordingly, 5 structural shifts are required. 1, move from reactive treatment to prevention embedded in education, labor, and community systems. Second, Integrate mental health into primary health care through structured task share. Third, decentralized early detection by replacing extension workers, counseling, support, and referral paths. Fifth, strengthen integrated data systems to ensure mental health is captured within the population, labor, education, and social protection plan. The silent emergency cannot be resolved by the health sector alone. It requires education systems, labor employment policy, urban planning, social protection, gender and youth programming, and private sector engagement. I wish to thank the Ministry of Health. Minister, thank you very much. I wish to thank Botanical Hospital, National Referral Hospital, for being open and providing us with the information. I wish to thank UBOS for strengthening population data systems. I want to thank our academic and civil society partners, and most especially UNFPA for sustained technical and financial support. The National Planning Authority remains committed to ensuring that mental health was directed are systematically integrated within the Human Capital Development Program under the NDP4 and the 10-4. And like I said, I have been directed that this report must be progress for this. Ladies and gentlemen, mental health is no longer a silent variable that has social story. It's now a defining determinant of whether our demographic transition translates into prosperity or pressure. Let us act.
Thank you so much, Dr. Joseph Mubawala, the ED of the National Planning Authority. Members of the press, permit me to now invite Dr. Juliet Nam, Environmental Hospital, to come and address us. You're most welcome, Doctor.
The Honorable Minister for Health, the Honorable Minister of State of Finance, Planning and Economic Development Planning, the Chairperson, the National Planning Authority, the ED, National Planning Authority, UNFPA representative, distinguished guests, members of the ladies and gentlemen. I'm honored to join you today for the launch of the 2025 State of Uganda Population Report. This year's theme, Mental Health, a Silent Emergency, is both timely and important as it draws attention to an issue that is often overlooked, yet continues to affect individuals, families, and communities across the country. By placing mental health at the center of this national conversation, the National Planning Authority has taken an important step in recognizing it as a critical development priority. And I commend the authority chair for this leadership. Allow me to express my sincere appreciation to the Minister of Health and the Ministry of Health for their continued leadership, guidance, and support in advancing mental health services in Uganda. The ministry's commitment has enabled the health sector as a whole to provide care to hundreds of thousands of Ugandans. The ministry has also supported in-service training of the general health worker in mental health outreach, support supervision, and many other activities. While we see daily examples of the human impact of mental illness, I think all of us see this impact. We also see powerful stories of recovery, of young people who return to school, of people who resume work, of people who rebuild their relationships, who regain hope and live meaningful lives after receiving our care and support. That is how important mental health care is. Ladies and gentlemen, from our daily experience at Tarika National Referral Mental Hospital, and generally as mental health care providers, the findings of the 2025 State of Uganda Population Report reflect the reality on the ground. We are witnessing an ever-increasing number of patients seeking mental health services, as highlighted in the report that you will hear. Honorable Minister, the National Referral Hospital at Tarika, as we speak, is full beyond the brim. It's not even full to the brim. It is beyond the brim. While this may be positive, when it is and reduce stigma and willingness to seek care, which we welcome, that may be positive. It can also be negative because it presents serious challenges for our health system and for the quality of services we provide. Quality of our services. The need burden that we are seeing cannot be overemphasized. And the Supreme has highlighted it very well. Some of our regional referral hospitals are yet to get a mental health unit. If they did, that would help to add some beds. We need more services to rehabilitate people who are struggling with alcohol and substance abuse. There's a small unit at Tarika, but that's not enough. I commend the Minister of Health, Honorable Minister, because in your wisdom, this NDP4, the Minister of Health has included construction of alcohol and drug rehabilitation units in the NDP4. Thank you, Honorable Minister, for that vision. But some funds, Honorable Minister, we need to find the funds to make this a reality. To create these regions on the soil. Because the burden is growing and it is affecting a lot of our young people. We shall not have a country tomorrow if we don't take action in this. And ensure the expansion of the structure across all levels of care to include mental health personnel, ranging from psychiatrists to psychologists to social workers, nurses, counselors, and others. We commend you for that. But the shortage of specialized mental health professionals, Honorable Minister, still dogs us. I know you're aware of this. At Botanical Hospital, we are aiming to become a center of excellence. In fact, a mental health institute, an institute of mental health in Uganda and beyond. But we still have less than half of the number of psychiatrists we need to manage the kind of load that we have, to manage a hospital, a mental hospital of this size, not to mention the handful of psychologists and other professionals. We're aiming to super specialize, and we look at training, we're looking at training specialists, super specialists in addiction psychiatry, geriatric psychiatry, child and adolescent psychiatry, forensic psychiatry. We need scholarships to train these specialists so that we develop a critical mass to develop peer training programs in these areas. Because now in Uganda they don't exist. So that we can in the future supply the Ugandan. But right now we can't do it. So we need a boost. So that working with our universities, we can make mental health greater. At regional referral level, Honorable Minister, we need to have mandatory recruitment of regional psychiatrists. I don't know how you can enforce that, Honorable Minister, but we are really guarding on this. In the regional referral hospitals, this would help to oversee the regional mental health aspects. At district level, Honorable Minister, the Mental Health Act 2018 provides for recruitment of mental health support persons. However, our establishment does not have that position. So that districts do not know at primary that would support the national essential healthcare. We need the community health extension workers currently being trained by the service delivery by doing activities around promotion of mental health, identifying need early, supporting referral, and maybe supporting tend to be at the because this is causing now this is causing frequent, especially outside. It is impeding outcomes and impact productivity of individuals who would otherwise be adding a brick to the economy of Uganda. There is need to dedicate funds towards mental health commodities so as to ensure the entire country is served. And we are requesting the Minister of Finance to give us additional funds. Honorable Minister of Finance, we are hoping that we shall get positive response. These realities highlight the urgent need for, and underscore the importance of increased investment in mental health countrywide so that the service can meet the growing demand, which the report is highlighting. Ladies and gentlemen, as the previous speakers have, as the coming speakers may not, population mental health is not just a medical responsibility, it is a shared responsibility. Other sectors, especially those in human capital development programs, such as the Ministry of Education and Sports, Ministry of Gender, Labor and Social Development, even the Ministry of Local Government, need to be on board to take some actions in the right direction. We need a policy on mainstreaming mental health across sectors. It's not enough to integrate in primary health. We need to mainstream across sectors. And I think use the right language. Yeah. Including in the workplace. There should be policies around this. As the report will highlight, the need for a formal coordination mechanism for all the multi-sector actors cannot be overemphasized. That way, we shall be able to provide well-coordinated, all-inclusive mental health care for all in need and achieve the much coveted universal coverage as stipulated in many of the Ministry of Health documents. The findings of the 2025 State of Uganda Population Report, therefore, as you will hear going forward, should therefore serve as a call to action for all of us. The mental health as national development priority, supported by clear policies, adequate financing, and implementation. Across, we need deliberate, ladies and gentlemen. Only then can we build the growing needs of our. The good news is that we now have all these the recommendations. Honorable Minister, I'm very hopeful that working with you, with your energy and interest in mental health, I know this because I work with you right from DIRA, you were interested in mental health.
systematically allow Ugandans to get attainable growth. However, a population weighed down by mental distress cannot fully participate in economic growth, unlocking this potential of our to mental well-being. So it's against this backdrop, ladies and gentlemen, 25 report adopts a life course and systems approach. It examines how mental health risks and outcomes evolve through youth transition, working life, and old age, and how these experiences interact with education, employment, urbanization, and social protection systems. So, distinguished ladies and gentlemen, by moving beyond a narrow facility-based view, this report positions mental health as a population-wide development concern. It highlights the social economic drivers of mental health and illness, quantifies the human and economic costs of inaction, and assesses the readiness of Uganda's health and social systems to respond. And in bringing these elements together, the report really provides an integrated evidence base to guide policy, planning, and investment. We must act now. We have the data, we have the information, and we could and must get it right. And as the National Planning Authority, we will continue working very closely with the Minister of Health, and I'm very pleased